WatchPAT is an at-home sleep study that is very, very helpful for patients to ascertain whether or not they have obstructive sleep apnea. It's a better technology than what we've had previously because it marries the better accuracy of an in-hospital sleep study without the hassle of having to go into the hospital for the sleep study. The reason that I wanted it is because we were always stuck with this big hassle factor of having to have patients go into a sleep lab in order to get the sleep study. Sleep labs have inherent weaknesses, one of the most prominent being that when you're not in your own bed and you have straps and wires all over you, then getting a good night's rest is almost impossible. So that always contaminates the results of the study. The old home sleep studies that were available, which were called 4-channel sleep studies, were never meant to be diagnostic. They were only meant to reassure us that we had the correct diagnosis in patients that so obviously had sleep apnea that we just needed the data in order to get the CPAP machine. But unfortunately, the powers that be and insurances were often insisting on utilizing that poor quality sleep study to diagnose sleep apnea, and we, I believe, would miss a lot of people with sleep apnea. What's nice about the WatchPAT, firstly, is it's the least expensive of the three by a wide margin. It's actually very inexpensive compared to an in-house sleep study or the old home sleep study. It's reasonably accurate and can also document that the patient has actually slept during the sleep study and is not laying there awake through the night contaminating the data, which is what would happen with the old sleep study. It's very easy for the patient to get it and for the patient to use it. How it works is it's called a watch because there's a watch-like device that uploads the data through the patient's smartphone for me to read the next day. It has 2 devices that are attached to the patient to take in data, one on the finger, which takes care of oxygen levels, heart rate, whether or not they're having obstructions, and something called peripheral arterial tension. That's the PAT part of WatchPAT, and that's what tells us what level of sleep they're in. This bit here goes on the chest, tells us which way they're lying, their breathing ability, and whether or not they're snoring. So it's a fair amount of data in the night. It uploads immediately to the computer and is literally in my in-basket the very next day. So we can give the patient the sleep study without having to wait weeks and sometimes months to get into a traditional sleep lab, and we can have the data back to them the very next day. So it's very efficient. It's also a better study in a lot of ways because people are able to sleep at home without disruptive straps and tapes and wires on them that contaminates the study to begin with.